Alright, so we're going to go over extubation. A couple things that we need to do a proper extubation. You're going to need Yankauer, bubbler, nasal cannula, 10 milliliter syringe to deflate the cuff. Make sure you got your suction ready to go, and some sort of an inline suction to make sure that you suction the lungs before you pull the tube. Now we're going to do extubation. Normally you would set the head of the bed up around 35-40 degrees, semi-Fowlers, and you would take a towel and lay across the patient's chest so that as everything comes out, we don't soil their gown or the patient themselves, because sometimes some stuff comes out and it's fun. Okay.
Lots of stuff
So
comes out.
at this point, your patient should be fairly awake and able to at least understand what you're saying and follow at least rudimentary directions. So you're going to explain to your patient, sir, we're getting ready to take the tube out. Before we do, I'm going to suction the tube, which is going to make you cough, and I'm also going to suction the back of your mouth. A little bit uncomfortable, but we need to make sure that all the secretions are out so that you don't breathe those back in. Okay? So you're going to hook a suction up to your inline. You're always going to do this first, because when you do extubation, you want to make sure that your suction is already hooked up to your Yankauer. Once you pull that tube out, you're going to instruct your patient to cough, and you're going to want to have that ready to go so that you can collect all the junk that they cough up that's been sitting in there. Okay, so do suction. You're going to go down with the tube, initiate a cough, start to slowly suction. Remember, you can be down for up to 15 seconds, 20 seconds. Slowly make sure you get everything out. Let them recover for a second. They're going to be coughing. It's going to be uncomfortable. While they're recovering, switch your suction over to your Yankauer. And then you're going to go in through your tube holder openings, and you're going to suck out the pharynx and collect all of the saliva and postnasal secretions that have collected in the back of the throat. You're going to suction all that out. Sometimes it may make them gag. Be careful about doing it. Remember, you're working with an awake patient at this point. Keep this suction plugged in and ready to go. So the next thing you're going to do, you're going to instruct the patient on what's getting ready to happen next. With some of the other tube holders that use the adhesive on the cheek, it can be fairly uncomfortable. So make sure that you give them fair warning before you start pulling those cheek pads off, that you are aware of the fact that it hurts and that you're going to be as careful as possible, but they also are going to know that it's coming. So maintaining tube integrity, making sure that it doesn't extubate too early, because we have not deflated the cuff yet, and that would be tragic. We're going to remove the manufactured holder, or if your patient was twilled, you'd be cutting the twill right now with a pair of scissors. So this can be uncomfortable for the patient because they are awake and you're starting to move that tube around, and it can make them gag, so we need to move quickly. You're going to instruct them on the count of 3. Big deep breath in, and then make sure that your syringe beforehand is empty. 1, 2, 3, big breath in, empty it out, and instruct them to start coughing. Okay, at this point you'll have the patient coughing. You're going to help them to collect some of the stuff that they cough up with the Yankauer. Keep that close by. They'll be coughing stuff up for a while. And apply your oxygen.